Hello, and welcome to this episode of NeuroRestorative Radio. My name is Tommy Treadway, and I'll be your host. I have Maureen Butler joining me today to discuss overcoming the challenge of distance when choosing a post-hospital neurorehabilitation program such as NeuroRestorative. Maureen is a regional manager for marketing and business development at NeuroRestorative and has over 30 years' experience in the brain injury rehabilitation field. Welcome, Maureen. Please tell us some of the challenges related to distance when choosing a post-hospital neurorehabilitation program such as NeuroRestorative.
Thank you. Thanks for having me here to talk about this. This is an area of considerable discussion when we're talking to families and hospital treatment teams regarding the next step after a hospital. Oftentimes, families are looking for a program that is, among other things, pretty close to their homes, right? So that they can visit frequently and spend time with their family member when they're done with their hospital level of care. Many times when someone's referred to neurorestorative, the program that is the best match for them is at a little bit of a distance from home. And this can be frustrating, it can be disappointing to families when they're considering their options. So oftentimes we're moving into discussions with them about that. For me, one of the interesting features of that is that the issue of distance is pretty relative to individual situations. Sometimes people feel like if they've had in their mind that they're going to go to a skilled nursing facility or a program a half hour up the street from their house, and a program is, an hour and a half or 2 hours away, that seems like quite a distance. In other situations, people feel like, going 2 hours or even 3 hours to a program isn't very far for the proper expertise for specialized rehabilitation. And then when they discover that perhaps the best match for the program is in another state or several states away, then that seems really far to them. So certainly discussing this issue with people depends on their relative perspective of distance and what that means to them and their family. One of the most important things that we talk about with people is when deciding about a brain injury rehabilitation program, the key thing to think about is expertise. So when people are comparing choices, it's important to look at which programs have been providing specifically brain injury rehabilitation for the longest period of time. Also looking at what programs might be CARF accredited and reviewed on a regular basis by rehabilitation accreditation agencies. And then really looking at the number of people served with your family members' difficulty and disability, and looking at what those outcomes are for people that have been served previously. I think it's important for people who support families and individuals with brain injury who are looking for their next best rehab setting to really have access to that information or be able to bring that information to families. The other thing that is really important and is helpful to families is to physically go and look, if they can, at the different programs that are an option for them. Sometimes going and looking at what an outpatient clinic would offer, if they're comparing our facility to going home, is important. Sometimes going to local skilled nursing facilities and then comparing it to what a program like NeuroRestorative offers is important. Kind of thinking about distance in the abstract without having specific visuals and specific conversations with team members is really difficult for families. And when it becomes a more concrete comparison, that's usually very, very helpful.
Maureen, can you speak a little bit about some of the things NeuroRestorative is able to do to help bridge that gap once their loved one is in the program?
Certainly, yes. We're lucky because we do have people come and use our programs from a distance in order to access the expertise. So we're familiar with that, and we've had a lot of families that have been in that situation, and our staff are familiar with that. So first and foremost, we have an appreciation for it and a lot of empathy around that with families, and we're aware of it. We also have used technology quite a bit lately, especially in the last 5 years, to bridge that gap between family and individual and team members, frankly. So things like using Skype or Google Hangout or other video-to-video conferencing with families is something that's very common. And sometimes it's every day. There's an appointment every day where someone talks to their family, or a staff and a program participant and a family might connect every morning at a certain time. And that has been terrific. The other thing that is important is, ideally, when you're in brain injury rehabilitation, you're very busy. You're very busy Monday through Friday, and there's a rhythm of work and a rhythm of productivity that should be helping people move from feeling like a patient to feeling like an active participant and active citizen. And so with the distance that way, sometimes it's nice to have families visit on the weekends or maybe one time during the week in the evening. And it creates more of a natural rhythm of family visiting that would happen if someone was, for example, going to work every day. And that has actually been, from a rehabilitation perspective, an added plus for someone to stop feeling so much like they're sick and in a hospital and beginning to regain the elements of their life again.
Why might a person choose neurorestorative even though it's not in their backyard?
You're going to go the distance for a specialized program, whether it's for cancer or maybe orthopedic surgery or cardiac disease, and that it's important for families to educate themselves about the different levels of expertise that are available. And not every rehabilitation program is the same, and that social workers and case managers at the hospital, in many instances, many will know a lot about the different levels of care, but it's also true that many will not. And so um, families should do some independent research for sure.
That's all the time we have today. Thank you, Maureen, and thanks to everyone for joining us today on NeuroRestorative Radio. For more information about NeuroRestorative, please visit us at neurorestorative.com and consider signing up for our Neuro Institute, which offers free 1-hour online CEU opportunities every month. You can find out more information about Neuro Institute at neurorestorative.com/institute. Until next time, thanks for joining us.